So is extension right for you? I don't know. We have to first take some baselines and test it out. But in this video, I am going to show you how to progress through an extension motion to see if that will be the right thing for you. So for many people that have disc-related or low back-related injuries, especially if you have pain that's like, you know, from back here to one side and it kind of comes down the leg, maybe below the knee, into the shin, the ankle, the heel. It doesn't matter. There's a lot of different places that can go, and that just depends on the nerve root. So for many of you that have that, if you're watching this and you feel like, hey, that's the pain or the symptom that I have, you'll often have symptoms of that are increased with certain movements like bending or sitting, or even rising from sitting. But to see if extension's right for you, we first have to take some baselines, and then I'll go through in the video here. I'll go through how to progress the extension movement, and then we have to retest those baselines based off of what we started with. Is there a change? Is there a difference? Did the pain move from, maybe it's far down and it moved further up, or maybe the intensity changed from a 7 to a 5. Maybe your ability to move changed. So at first we want to make sure just to take a mental note or a baseline of, how far down it is. Then let's take it, how far can I bend forward? How far can I bend backwards? And then how far can I move my hips to the left and to the right? So when we do that, we take those mental baselines, and I want to see, as we go through the progression of the extension, what changes, okay? Here we are with the extension. So what we want to do first is just go flat. So when you even just take your body weight away, and now you're essentially in like a standing position because you're still flat, but do you feel different lying on your stomach versus just standing flat? So you want to make a note, is that pain any different in your leg? Is it further up? Is it further down? Is it more intense? Is it less intense? All right, if it's the same, it's fine, we keep going. If it's less intense or the same, let's move up to, forearm. So just put a little bit of slight extension in the lower back. We just want to see what happens. I wouldn't stay here for long, 15, 20 seconds. We're just testing. What happens to that leg pain? What happens to the back pain? If it feels like the leg pain is reducing, even if the back pain is slightly increasing, that's okay. Then just come back out of it, okay? What happens there? I'll kind of calm back down again. I was getting a little bit more pain in my hamstring, but when I came back down, it relaxed again. Now it's back to a 5. Come back up again. What's that feel like? If I stay here for 10, 15, 20 seconds, it's kind of increasing into my calf, like a 6, 7. Okay, come back down. Nope, it's kind of reducing back down again. So those are all yellow lights. None of that's wrong yet. So we still want to test. Now, if we go from here to here, the next step would be to go hands low under the shoulders, keep the hips relaxed, and you're just going to press up as high as you can. Don't stay there. Come right back down. Now, you may not be able to go all the way to the top in the first one. That's fine. Don't worry about it. Just keep it as relaxed as you can. Go as high as you can. Make a note of where the symptoms are. Ouch, that hurts down my leg. I feel it on my calf. Okay, come back down. Nope, it calms down. It's no worse. It's still a 5. Okay, 6, 7, 8. That hurts. Ouch, I don't like it. Come back down. If it feels like that, again, those are not red lights. Those are yellow lights. Keep trying. Keep testing. If you can, get a set of 10 or 12, and each one, try to go just a little bit higher each rep. You might notice that it is easier, that rep 9 is better than rep 2, right? So you might get further and further as you go, okay? Then, after that 10 reps, we want to come back up, and we want to retest the baselines and see if there's any difference. Okay, so here we are. We want to retest the baseline. So now that you've done the 10, we're back up. Did the location change? If it feels like it's further up the leg, that's a green light. If it feels like it's the same spot, but it's slightly less intensity, also a green light. So you want to check those 2 locations as far as pain location and pain intensity. Then the third one is, okay, how do we move? Can I put any more weight on that leg? Can I slide my hips, further to the side as before? Can I bend any easier? Can I extend any easier? If any of those things are yes, where it did make a change, you're likely showing that directional preference, and I would keep using that extension, all right? You don't need to do all of them at one time. A set of 10. Stand up, check your baselines, go do something else for an hour or 2. A set of 10, same thing. You got to cumulatively, throughout the course of the day, 24 to 48 hours, get a good like 70, 80 reps in, but you don't want to do them all at once. But you're constantly rechecking that scorecard and figuring out what is it doing to my pain, location, intensity, and how are my mechanics afterwards. Thanks for watching.